again, I'd like to welcome you to part one of the Welcome Home, Creating a Campus Climate of Wellness for Returning Veterans program. The purpose of this presentation is to create awareness about the mental health needs of some of our student veteran population. And with this training, we hope to increase awareness about the signs and symptoms of post-traumatic stress disorder, which is often referred to as PTSD, traumatic brain injury, which we refer to as TBI, and also depression, so that those who work with student veterans on a daily basis can better recognize those symptoms and respond to those conditions. We have a fantastic speaker today in Dr. David Joseph. Dr. Joseph currently provides treatment for veterans with readjustment stress in combat or military sexual trauma at the Oakland Vet Center. As a psychologist at the National Center for Post-Traumatic Stress Disorders, Dr. Joseph served as the primary clinician on a multi-year study of seeking safety in veterans with co-occurring PTSD and substance use disorders. In addition to these trainings, Dr. Joseph has developed trainings for police officers, first responders, and providers on effective interventions for veterans with PTSD. He completed his clinical internship at Napa State Hospital and received his PhD in clinical psychology from Alliant University in San Francisco. Are you ready, Dr. Joseph?
Oh, I'm ready.
Okay, so with that, please welcome Dr. David Joseph.
Hi, everyone. Good morning. A little fun this morning on 880 and 101 and 90. Anyway, it's good to be here. What we're going to be doing today is really focusing on some of the mental health issues, in particular PTSD and traumatic brain injury, that some of our veterans have when they come home. So we're also going to talk about some of the transition challenges that folks have. Some of those are not actually mental health challenges per se, and kind of put that picture together for you, try to create a real idea for you of what it is that many veterans deal with when they transition out of the military and come back to community colleges. We already talked about that. Okay, so let's start with this, in case you haven't seen this somewhere else. 2.2 million veterans residing in California, leading the nation in veteran population, not what you would necessarily anticipate about California. The number is going to increase, and the majority of those students enroll where? In California community colleges, at least as a starting point. And there are a lot of good reasons for that. More than 44,000 veterans used their benefits in 2010, 2011, and I have a little slide to show you that. Notice the increase, and that doesn't include active duty. So really, when we're talking about this issue of veterans on campus, describing veterans coming home, using community colleges to start their careers and refocus their lives, we're talking about a trend that's increasing, and I have to imagine will continue to increase for at least some time. Thank you. So let's start with the coming home. These are my favorite images. I love these images. When I see these images, I always get teary-eyed and emotional. This is, really what it's like for a lot of veterans as they come home. There are these moments of incredible gratitude. They're excited. They're reuniting with family members. Unfortunately, for a lot of veterans, first of all, this is not how it is for every veteran. Some veterans come home. I talked to a veteran recently, and he came home and called a cab and went to his apartment and then realized they didn't have any food, and then went and got himself some food, and then he cracked open a beer, and that was his homecoming. So it's not always that you come home to this kind of scene. But even when you do, for many folks, the next step resembles this quote. Home, the place many think is the safe haven to find relief from the stressors of war, may initially be a letdown. When a loved one asks, what was it like? And you look into eyes that have not seen what yours have, you suddenly realize that home is further away than you've ever imagined. I think that that's an experience that a lot of veterans talk about. Both the elation of being home, the excitement of seeing loved ones, the excitement of feeling safe if they do feel safe, and yet an incredible isolation that they feel at the same time. Has anyone seen the movie The Hurt Locker? Hurt Locker, anyone? Okay. So, there's some issues with the film in terms of the roles, and they've made Hollywood parts of it, but really one of the best parts of the film from my perspective is this is the scene where he's home. I'm not going to ruin it for all of you who haven't seen it. There's a scene where he's home, and he's walking down the aisle at a supermarket, at a shop, and he's trying to decide on cereals. And he had just been in Iraq trying to not blow up bombs, but trying to disassemble bombs. And the next thing he knows, he's walking down this aisle where he's got 30 or 40 or 50 or 100 cereals to choose from. And you get this sense of incredible isolation and incredible incongruence that he hasn't worked out and can't work out how to take the life that he just had and somehow fit it into the life that he's about to have. And again, not to ruin it for you in the movie, but he goes back because it's so difficult and complicated to work that out. Well, so for a lot of our veterans, they don't go back, or at least when they're done, they don't go back. They go to community college and move on. But first of all, let's talk about some wounds of war. We're going to talk a lot about psychological, mental health issues today, but let's talk about physical wounds for a second to just say 16% suffered a serious injury. Sometimes you will see evidence of that injury, a missing limb, someone walking with a cane or a crutch, and sometimes you will not. It's not always apparent how much chronic pain someone might be in, for example. Those who suffered injuries twice as likely to report trouble adjusting, 3 times more likely to have PTSD, and less likely to hold full-time jobs. So that's a group of folks who has a more difficult time adjusting, as one would expect. So typical transition challenges. And I would say about this, that regardless of whether you have PTSD, traumatic brain injury, or a physical wound, these are transition challenges that are, to some degree, not for everyone, but to some degree almost universal, some version of this for most veterans. Feeling separate, as I talked about, managing expectations. I know when I was deployed, I served in the Israeli army, and I was up in Lebanon, and I had this idea of all I really wanted, and I really mean this, all I really wanted, and I wanted it so badly, was a cold Coca-Cola and a bucket of Kentucky Fried Chicken. I cannot tell you why Kentucky Fried Chicken came into my mind, but it did not leave my mind for the entire time that I was in that area. And you will be surprised to learn that when I got home and I had my ice-cold Coca-Cola and I had my bucket full of Kentucky Fried Chicken, which I will assure you I did have, it really just wasn't, at the end of eating the chicken, other than feeling nauseous, it was like, well, now what? I've done the one thing that I wanted to do. I've done the 2 things that I wanted to do. Now what do I do with the rest of my day, and what do I do with tomorrow, and all these ideas about what I think life is going to be like now, because it's been built up and built up and built up in my mind. I'm going to go do this, and I'm going to do that, and I'm never going to do this again. And then you find out that you're really just returning to normal life, which largely isn't that exciting on a day-to-day level. Finding employment, particularly if you came home during recession, as many of our veterans have. Finding employment very difficult, rebuilding community, connecting to old friends when you have changed and they have changed is very difficult. So a lot of the veterans that I talk to try to, or in fact do connect to old high school friends, people who still live in their neighborhood, and so much has changed since they entered the military that they often find that even though they like each other, they can't really relate to one another particularly well. So again, all these expectations of what life will be like sometimes, I won't say come crashing down, although that happens too, but I think sometimes there's a tremendous disappointment, a tremendous letdown, lack of daily structure. When you're in the military, one of the greatest assets of being in the military is that you can complain about all of the things that you are being told to do during the day. that's kind of the way that it works. You're told how to deal with your day every day when you're in the military, and then you complain about it, and that's kind of part of the fun of being in the military. When you get out of the military, there's not only no one to complain to, there's no one telling you what to do. Your day is completely unstructured. Should I go to class? Should I not go to class? What do I do after class? Should I get a cup of coffee? Should I go to the library? Should I go home? Should I play Xbox? There's a new Call of Duty. I don't want to do that. Maybe I'll go for a run. These are all things that are, I would say, largely difficult for a lot of us when we have a lot of extra time, but particularly difficult when you're used to having no extra time, or at least having most of your time be highly structured. So that can be very tough. And then finally, finding excitement in everyday activities. Let's be honest, for all, as bad as it is in many ways, and as damaging, as frightening as it is, deployments generally are not boring. I mean, there are probably long moments of boredom, but in general, they are not boring. Being part of that enterprise is not boring. When you come home, and I know some of you are probably outstanding instructors, but going to school is really not that exciting. It just isn't. And so a lot of veterans have the experience of having all this tension and all this pressure, but also all this excitement that's built into their life, suddenly drain out of it. And you're 24, you're 25, you're 26, and you're thinking, huh, this is it, huh? Go to school, get a job, right? So there's a real letdown there for some folks. One of the really typical transition issues that I pick up on is communication and language, which is to say the difficulty that a lot of veterans have explaining their experiences, their thoughts, and their feelings to others who were not there. I would say that's almost universal. And I would say that a number of things complicate that. One of the things that complicates that is how separate and isolated the military experience is from the civilian one. When when military service members are 1/2 of the population at any given time, they are, as coming from Oakland, really the 1%, right? And so there isn't a lot of community around them who's been there and done that. That's number one. Number two is that in order to explain your experiences and your thoughts and your feelings, you have to actually know what they are. And many of the veterans that I talk to, particularly those who have had difficult experiences, don't know yet really what they thought and what they felt about what they did. They could tell you the sort of after action report of what they did and where they went. But the analysis, both emotional and intellectual analysis of what just happened, what did it mean to me, what's it about, that actually takes a fair amount of time. And sometimes there's, on the part of the veteran, not just family members, a real avoidance of doing that because it's hard, it's disturbing, there are a lot of emotions involved in that. And so part of the difficulty of explaining what it is that happened over there is not having the words yourself, not knowing how to answer the question, or finding yourself answering the question in a way that sounds wrong to civilian ears. So something that was funny or amusing or cool while you were deployed may sound horrific to civilian ears. And as you start saying it and you see the look on someone's face, you realize that you're not speaking the same language. And I think that's a very isolating experience for people. In many cases, for everyone in the family. Because the veteran feels they can't really talk about it, and the rest of the family wants to know, but doesn't really feel like they can and doesn't have access to it. We'll see a video clip on that in a bit. Communication. Typically, there is a more assertive style that's used in the military. Not always. And adjusting to a less direct, less assertive communication style can take a little bit of practice. You have to kind of realize that you're doing it and that there's another way to do. So this is how it is in the military, and at least where I live, it's a little bit more like that. Okay? And I'll tell you on a personal note, when I was in the Army, I got out of the military, and I was a little bit older. I'd been to college, and in theory, should have known some things. And I'm 2 weeks out of the military, and I needed to find a movie theater. And I walked up to a woman, and I said, "Where's the movie theater at?" Thinking absolutely nothing of it. Thinking nothing of it. There was a piece of information. There was a functional purpose to my question. I assumed she had the solution, so I addressed it like that. It didn't seem remotely assertive or aggressive to me. And the next thing I knew, I was with someone who wasn't in the military anymore. You know, I felt a hand on the back of my neck and just pulling me back and said, "You can't talk like that here anymore." Now, in my case, I'd only been in for a year, and again, I was older. It was a little bit easier to kind of work that out. But for a lot of folks, this kind of speaking has been the way you've been speaking and the way everyone around you has been speaking for a really long time. So transitioning out of that can be difficult. It's literally like learning a different language or learning a different accent, right? It can be difficult. Reconnecting to relationships is often very stressful in many different ways. Deep friendships in a combat zone are formed based on intense shared experiences. The funny part about deep friendships that are formed in combat zones or combat scenarios or war zones is that you don't have to like each other. You may dislike each other a lot, but when you're in a combat zone together, you love each other a lot. The opposite is true in our relationships when we come home. You have to like each other a lot in order to have good civilian relationships. The loving part is less important for most folks. I'm not talking necessarily just about intimate relationships, right? Our day-to-day relationships are more based on, do I want to hang out with you? Do you want to hang out with me? Do we like the same movies? And so on and so forth. Whereas military relationships are often based on something completely different. And so that transition can also be a hard one to make. A lot of veterans talk about their civilian relationships being very superficial. Yeah, they're cool guys, but if something were to happen, I don't know if they would have my back. Well, what would happen? I don't know. I'm not saying anything would happen. I just don't know if they would have my back. That's something that I would hear a lot. So it can be hard to reconnect to that. Driving differently. I'll show you a clip of this later if we have time. Combat zones means keeping other vehicles at a distance, driving fast, being on guard for ambush or IEDs. At home, yeah, I mean, I was just driving on 880, so I can say that it felt like a combat zone. But at home, that's not the way that you drive, or at least not the way that you're supposed to drive. You're supposed to drive with a very different mindset here, and that can get veterans into quite a bit of trouble. Both legal trouble, and generally just adds a lot of stress to being on the roads, which makes it more difficult for them to get out of the house, which keeps them isolated, and so on and so forth. So driving is often a real stressor for veterans. So where is that particularly relevant in a community college setting? If you have a class at 4 o'clock or 5 o'clock, you're asking your veterans to drive through traffic to come see you, or in the morning, you may be getting some pretty surly folks, right? Nobody likes traffic. But for veterans who are kind of getting readjusted to road driving here in America and back in the civilian world, that can be particularly difficult, especially if there's some PTSD, and especially if you're paying a lot of attention to things like garbage on the side of the road because you're wondering if it's going to blow up. One veteran said to me recently, he said, you know, when I see a gas tank, I don't see what you see. You see a gas tank, I see a bomb that hasn't exploded yet, right? And so what he'll do when he sees a gas tanker when he's driving is he will, ironically, probably drive really dangerously fast to get around it because he doesn't want to be anywhere near this unexploded bomb because that's how he sees it. Ironic, like the irony is that he probably puts himself in more danger by the way he gets around it, but that's a different issue. So mental health challenges, let's jump into that. Here's what I'm going to say about these numbers. I want you to both pay attention to them and not pay too much attention to them at the same time. And what do I mean by that? I would say that these numbers are generally more or less kind of pretty accurate. Okay? They probably represent something that's true, which is to say probably around 20% of folks who come back from Iraq and Afghanistan will measure positively for post-traumatic stress disorder and depression, or depression. Probably around 20% of folks coming back from those conflicts will measure positively for having a traumatic brain injury, usually mild, like a concussion. Are those numbers exact? No. Every single study that I see offers something slightly different. It depends which soldiers or which service members you're asking at what time. Did you do a baseline? Did you not? There are all sorts of things that you could be asking. But so here's what I want you to take from that. There's kind of two main points here. Number one, it's probably around 1 in 5 to 1 in 4 folks coming home will have 1 or 2 or 3 of these issues. But it's probably not 50 or 60%. In fact, I would say it isn't. So the thing to remember is 70% have no mental health disorder. When you're talking to a veteran who's recently come home, we should not make the assumption that this veteran has PTSD, this veteran has a traumatic brain injury, this veteran is depressed, and so on and so forth. The vast majority of veterans come home and don't experience mental health disorders. They do have readjustment stress, almost always, but not necessarily PTSD, TBI, or depression. Okay? Nonetheless, the numbers are high. Just to give you a sense of this and also to show you how much I like PowerPoint, here is a list. So in blue, you'll see not deployed, and in pink, right, deployed, levels of, this is troop strength over the last 10 years, and here are the numbers of PTSD. Pretty clear, right? I mean, you don't have to do a deep statistical analysis to see that as we added troops, we increased levels of PTSD. Okay? If there was another graph that showed combat exposure, that would also be highly related. So obviously, the more tours that you do and the more combat tours that you do, the more likely you are to come back with PTSD. And I would expect that if you have done 7 combat tours to Iraq and Afghanistan, the chances of you having PTSD are significantly higher than 18.5%. In Vietnam, we generally talked about around 33%. So when we look at the numbers, when we say 1 in 5, we're talking about everyone who deployed to a combat zone. And that should tell you 2 things. Number one, that folks who experienced high levels of combat over a long period of time probably have a higher rate of PTSD. But it also tells you that everyone who went to the war zone was subject to stressors that might cause post-traumatic stress disorder and traumatic brain injury. Some common existential issues. These are things that I think really add to the stress of coming home, really make coming home very difficult for a lot of veterans, and are often not talked about. Typically, if you go to a VA appointment and you go see a psychologist, even a really good one, and you do your treatment for PTSD, it's often that you don't come to these questions until the very, 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 very end of your treatment, because they're these are the philosophical kinds of things that we'd like to get to, but we have a lot of clients and we don't always get to with you. And what a lot of veterans talk about is that they will try to have these conversations about higher powers, about am I a murderer because I killed, no one will ever understand me, those kind of questions. They'll go to a chaplain, they'll go to someone at their church, they'll go talk to someone that they feel close to, and often report very unsatisfying conversations. Because if the person doesn't really understand the experience of being at war, what they'll get oftentimes are slogans in response, which isn't to say the person isn't trying to help them. But someone who hasn't been in that experience and hasn't, let's say, killed, may not really understand, right? It's really easy for me to say to a veteran, no, of course you're not a murderer because you killed. You served in the United States military and that's honorable. Yeah, that may be true. It's not satisfying for someone who's really wrestling with this issue. And so underneath a lot of the isolation are some of these questions that are very difficult to answer and very hard to answer by themselves. Interestingly, some of the ways that veterans do attempt to kind of wrestle with these issues is in their work at community colleges, in their essays and papers and speeches. And we talked yesterday, if you were in my discussion, about disclosure. So that can be a very helpful way to start making sense of those things when appropriate. Okay, let's talk about PTSD, my favorite topic. PTSD is in the news a lot. So how many of you have heard or read or seen some article or heard something on NPR about post-traumatic stress disorder? Okay, that's the good thing. The good thing is that you've all heard about it. And that after the Vietnam War, no one had heard about it. So we've made tremendous progress in that area, and that pleases me greatly. On the same page, what can be frustrating about that is that though many of us have heard about PTSD, it's hard to really know a lot about what it is and what it isn't. And a lot of veterans come home with the experience, even if they have PTSD, of every time they do anything, are frustrated, can't sleep, do something, all of their relatives start pointing fingers at them and saying, "You've got the PT thing. You've got it." Right? And I don't know why, for some reason, it's only 4 letters, but everyone, PSTD, and no one gets it right. But I think a lot of, and so a lot of veterans will come into treatment and they'll say, "I have no idea if I have it, but my family has already diagnosed me." And sometimes that actually works against us because there's this that happens. The arms crossed of like, well, I'm not going to go just because everybody told me I have to go. But let's find out actually, so now that we have the chance, let's find out more about what PTSD is. And I'm glad to have this opportunity, largely in my role as a psychologist at the Vet Center. I work with veterans who have PTSD, I would say about 90% of the time. So 90% of the clients that I see are veterans with post-traumatic stress disorder. 10% don't have PTSD and have some other issues, but mostly I'm like a television with one channel. And this is the only channel that I can watch. But it's an interesting channel. So, of these horrible things that are on the list, combat, childhood abuse, rape, accidents, assaults, disasters, which of any of them would, do you think, be more predictive of someone having PTSD? Which is to say, if one of these things happened to you, you would be more likely than the others to have post-traumatic stress disorder. Who says combat? Who says childhood abuse or rape? Accidents? Assaults? Disasters? Okay, so those of you who said child abuse or rape are correct. Actually, what we find in the world of trauma is that the more interpersonal the trauma, the more likely it is to cause profound, lasting effects, and particularly in the shape of post-traumatic stress disorder. And the most interpersonal trauma that we can really conceive of is childhood abuse or rape. The rates of PTSD in boys, for example, who've experienced childhood rape are approximately 60%. Okay, natural disasters, the rate is actually considerably lower. Not that any of these are good experience to have, but one of the reasons that it's lower is that when there's a natural disaster, there's no one really to be angry at. Nothing was done to you personally, right? There was a flood. Nothing was done to me personally. The more personal it becomes, the harder it is. So one of the things that we need to be aware of is that sometimes, and I would say more often than we would think, and certainly more often than we would like, the veterans whom we talk to who have significant amounts of combat trauma came into the military with significant amounts of childhood trauma. And oftentimes there's a kind of logical, linear reason for that. And again, I'm not trying to stereotype anyone that goes into the military, because that's certainly not true of everyone. But there is a subset of folks for whom their family of origin was not working out very well, for all sorts of reasons. And they looked and they said, what I really need is a new family. I need a better place to go. And they went to the military. And largely the military was a good thing for them, became a new, stable, structured, caring family, the new community. but then they were exposed to these other stressors. And so oftentimes what we're talking about with veterans is a combination of childhood abuse and rape, some version of childhood abuse that then after years later gets compounded with combat trauma. And from a therapeutic standpoint, sometimes, interestingly, as bad as the combat trauma is, the thing that really needs to get worked through is the childhood trauma. And when you do that, actually, sometimes the combat trauma gets worked out faster. When we're talking about PTSD, we're going to go into all of the symptoms of PTSD in a minute, but when we're talking about PTSD, the main thing that I want you to know about it, because it's often hard to see, the main thing that I want you to know is that PTSD is at its core anxiety. It is a disorder of anxiety. It's in the anxiety disorders classification of the DSM, but ultimately at its heart, it is the experience of being anxious, nervous, fearful, uncomfortable, oftentimes 24 hours a day, 7 days a week. So you will often see folks with PTSD who maybe present as angry or numb or distant, but ultimately underneath all of that, and all of that may be true, but underneath all of that is the experience of tremendous levels of anxiety. And if you know that, you can speak to folks with PTSD in a slightly different way. Many of our veterans are not capable or don't know or don't think they can tell you, I'm feeling really anxious right now. I'm feeling really uncomfortable right now. Largely what you'll hear instead is, I gotta get out of here, this is bullshit, I don't want to do this, no, everyone's a horrible driver, some version of all that. And what you don't hear is, when I am driving to your class, there are so many cars around me, I feel trapped, I feel anxious, and I just want to get out of there as fast as possible so that I can breathe, which is in many ways what it actually feels like. So remember anxiety. Symptoms usually begin soon after the traumatic event, but they may not appear until months later. Typically, right after the event, there's the experience of PTSD symptoms, and for that reason, we don't really call it PTSD unless it hasn't gone away for a month. And one way to think about that is this. You are in a fender bender. Anyone here been a little fender bender? Yeah, I'm sure it wasn't your fault. So you're in a fender bender, and what do you do the next time you get into the car? You kind of, particularly if you got hit from behind, you're driving along, you get hit from behind, you didn't see it coming. What do you do when you get into the car? What's it like for you? Somebody just throw something out.
Look behind you.
You start looking behind you. Yes. What else? You're more cautious. You put your seatbelt on. You do the whole 10 and 2 thing on the steering wheel. If you're like me, you stop texting. Okay? And you are really, and if we were to check your pulse and your blood pressure, probably all of that would be elevated. You're gripping the steering wheel probably just a little too tight. Okay? You won't let the kids talk in the back because you say, you know, Mommy, Daddy has to concentrate, right? But what happens after 2 days, 3 days, 4 days, 5 days? One hand back on the steering wheel, the radio comes back on, you're feeding your children, you're texting, because you start to recover. So you start to have symptoms of PTSD, right? All of the elevated fight or flight response that is involved with PTSD, but over a short period of time. Now, again, a fender bender isn't a trauma, but even in that case, your body will have a physiological response to it, but over time it will diminish. Where PTSD is different is that over time it does not diminish. And over time could be a year, it could be 5 years, it could be 20 years, and in the case of some of the World War II veterans that still come to our vet center, it could be, anyone good at math? 70 years, 60 years, many, many, many years. The flashbacks and intrusive thoughts and symptoms that our World War II veterans have are as vivid to them today and as powerful for them today as they were when they, I would say when they were in, not maybe immediately after they came home, there's probably a little bit of an improvement, but as vivid as they were for the last 30, 40 years. So a thing to know about PTSD is that for many people, it does not go away on its own. And why is that good to know? Because when you're talking to a veteran, sometimes they'll say, yeah, I got in the military in 2003, and it's now 2012. And you think to yourself, well, that was kind of a long time ago, right? But they're still responding to their brain, and their anxiety is still responding to the same sense of threat as if they were back into the war zone that they were in 10 years ago. Okay, good to know. So one of the things we do when we talk about PTSD is we refer to it as a failure of recovery. Everyone has the symptoms, most people do, but for folks with PTSD, they don't experience recovery. Okay, so we just covered that.
Could you explain that again? So PTSD you don't recover from?
Well, when anyone has a traumatic event, and any traumatic event, whatever it is, you're going to have a physiological response to it. Your body will respond to trauma, and that's one of the reasons, for example, they don't do PTSD therapy immediately after a trauma, because what they've learned is that it's more important to give you 3 to 4 weeks to just recover on your own. I mean, we create a supportive environment, and there are things not to do, but largely, for example, in law enforcement, first responders, they went through a period of time about 10 years ago where they would do this intense debriefing, critical incident stress debriefing, right after a trauma, and what they realized is that that actually can inhibit the very natural recovery process that the vast majority of us will have. Okay? But for some people, that natural recovery process doesn't happen. Here are the symptom clusters. I'm going to teach you the clusters of PTSD, the different symptoms, but let's start with the idea that if you have PTSD, you don't experience these as clusters. Okay? You experience them all together in different ways at different times. We categorize it this way because it helps us think about PTSD, but that's not the way it actually feels. It feels all jumbled up together. Okay? Reliving, avoiding, being hyper-aroused, and being numb and detached. Now, I'll go through each one with us. If you have PTSD, you likely think about the trauma when you don't want to. So we talk about an intrusive thought when we talk about PTSD. And the word really to concentrate on here is intrusive, similar to the word intruder. So thoughts will come into your mind when you don't want them to, at any time. They are uninvited intruders. And the experience of PTSD is the constant experience of either thinking about the very, very, very worst thing that you don't want to think about, or trying really hard not to think about it. So it's a constant this. I'm trying to push it out of my mind. I'm not trying to put it's actually on my mind. But here's the problem with that. If I say, no one here can have lunch if you think about a pink elephant. You will not get lunch if you think about a pink elephant with its long pink trunk and its big pink flappy ears. Who succeeded? Anyone succeed in not thinking about pink elephants? Okay, can't do it. Because that very act of trying not to think about something is the act of thinking about it. You have to think about it as you're telling yourself not to think about it. So there's the trap of intrusive thoughts, that you get stuck in this constant battle which actually causes you to think about the things you're not thinking about or don't want to think about. Part of that then also comes out in the forms of frightening nightmares. Many of the veterans that I talk to describe incredibly traumatic, horrible, disturbing nightmares, sometimes on a nightly basis, sometimes violent nightmares, and I don't just mean the content is violent, I mean the veteran actually becomes violent in their sleep. Many veterans have had the experience of waking up and choking or punching or kicking a loved one who is sleeping next to them with absolutely no concept that that's what they're doing. It's an incredibly scary thing to have happen. It's an incredibly embarrassing thing to have happen. I'm going to go out on a limb and say it's not great for your relationship when that happens. I've actually never heard, I'm not saying this has never happened, but I personally have never heard of a situation where a veteran didn't stop. It's always somehow the person gets them awake, or the veteran comes awake and they stop. So I've never actually heard them really, really hurting someone, but I've definitely heard of veterans really scaring someone and hurting them a bit. And then the nightmares themselves are typically very frightening. It's often either directly war-related, like I was back in Iraq and insurgents had captured me and were about to torture me, and that's when I woke up. Talk to a veteran, he has some version of that dream every single night. Or it'll be something really metaphorical, like I'm being chased. That's one of the most common ones. I'm being chased. Someone is trying to get me. I can't see them. I don't know who it is. I'm being chased. I'm fighting. Who are you fighting with? I don't know. But I'm fighting. Those are typical PTSD, traumatic dreams, even if your experience, your traumatic experience was not fighting. Right? So even sexual assault survivors who their experience wasn't in combat necessarily will still have traumatic dreams that sound a lot like those people who were in combat. Finally, there are flashbacks. What is the difference between a flashback and an intrusive thought or any thought?
Flashback is like reliving the
Yes. Okay, so a regular memory, a flashback is kind of like a memory, but a regular memory is, I say, who remembers the first car you ever drove? Anyone have a good one?
I drove a car that we paid $99 for.
A $99 car. Did it have wheels?
Yeah, but the fender was wood, you know.
The wood fender. Okay.
And I didn't know how to drive, so that was my first time driving, so I was shaking and sweating.
I'm sorry to ask you to relive that. All right.
That's how I learned to drive.
See, so it was an opportunity for growth. That's right. That is a typical memory. I would guess, and maybe it's not true, but I would guess that before I asked you to think about what your first car was, the first car you ever drove was, you were not thinking about it. Okay, that's a typical memory. A flashback is a memory, and sometimes not even exactly a memory, where you are in fact, so while you're having that memory, you're sitting here thinking back to the car that you used to drive. A flashback is you are not sitting here. You are actually back in your wooden car. Right, you are actually back wherever it is for that moment. You're not really here, you are there. And then that's how it differentiates. It's almost like a hallucination, in a sense. And incidentally, that's part of what's so scary for a lot of veterans who have flashbacks, is it feels really crazy to them. So one veteran that I talked to recently, and this is not uncommon, when he goes to the restroom at work, as he comes out of the restroom, he's in a hallway. And there's something about the hallway that triggers a memory of a hallway in a building that he had to clear, had to take over when he was in Iraq. And so literally what happens is, as he opens the door to the hallway, he goes like this, and he raises the weapon that he now doesn't have, and he's in Iraq for about 10 seconds until he catches himself, goes bright red with embarrassment, and scurries off back to his office. And it happens to him every day. That's a flashback. He was not in that moment. He doesn't say to himself, wow, this hallway is scary and reminds me of this other hallway. That would be here and now. He's actually in Iraq for about a few seconds. And then he comes out of it and he realizes where he's at. By the way, we'll find out if this worked, but my solution to that was for him to bring a really big teddy bear with him to the bathroom. And that he would be so, feel so ridiculous that he would just be completely out of this. Like, you can't be in Iraq if you're holding a really big teddy bear.
Did it work?
Well, I'm waiting to find out, but he was worried. He said, what do I tell people if they ask me why I'm bringing the teddy bear to the bathroom? And I said, tell them the bear had to go. So, we'll find out. We'll find out. Avoiding. If you have PTSD, you might avoid situations or people that directly remind you of traumatic events. So like this hallway, for example. One of the ways that this veteran has dealt with the hallway is to try really, really hard not to use the restroom at work. Okay? It makes sense, right? If the hallway is a trigger, don't go in the hallway. So he doesn't. avoid talking or thinking about the trauma or doing things that will get you to think about the trauma. Avoid situations that trigger a fight or flight response. So that doesn't necessarily have to be a memory. Not everything has to be associated with a memory. It could be anything that triggers this, whatever that could be. And we'll have a list in a minute. Prefer to spend most of your time alone at home to avoid being triggered. So the kind of classic stereotypical example of the Vietnam veteran who lives off the grid in the hills, we understand why. Because if everything, and you'll see in a minute, if everything essentially could be a trigger, then the best thing to do, ultimately this isn't true, but one could see how you would feel this way, then the best thing to do is to simply remove yourself from all possible triggers. That's a good strategy, except that the consequences of that are that you don't have a life. That your life becomes, if that ends up being what happens, and typically that is what happens to some degree to a lot of veterans with PTSD, is that over time your life becomes smaller and smaller and smaller and smaller, and that's where we start really worrying about depression, where substance use often takes its toll, because there really literally is nothing to go out of the house for anymore. And that's what we're really hoping to avoid in our younger veterans, getting to a point where, like some of the Vietnam veterans we see, they don't have friends anymore. They don't have relationships anymore. They don't have hobbies anymore because they have isolated themselves from those things just to feel, not to feel good, but just not to feel bad, if that makes sense. The flip side of avoidance, and one thing that will help us understand avoidance, is hyperarousal. So if you have PTSD, you feel jittery or stressed most of the time. You're constantly alert and on the lookout for danger. So for example, someone with pretty severe PTSD, would they feel comfortable sitting over here? No. Why? Because they don't know all of the people in the room. Some of you look sketchy, let's be honest. And if someone did something in here, they would have to get through all of you sketchy people to get out the door. Okay? Now, I look at this room and I see no danger. But I don't have PTSD. My mind isn't thinking that way. If you've been in those situations, you have PTSD, the experience of being in a crowded place filled with strangers is very, or can be very alarming to your mind. Feeling very uncomfortable with strangers. So, first day of class. You ask a student to stand up and introduce him or herself in front of a whole group of people that this person doesn't know. Terrifying. Terrifying. Because you can't keep track of all of the people and what they're doing and where their hands are. Okay? Have trouble falling or staying asleep? No kidding. Find it difficult to concentrate? Of course not, because your mind is occupied with being on alert all the time. So how could you possibly read this beautiful passage by Proust or somebody brilliant? Steinbeck. Did someone say Steinbeck? You can't. It's very hard to concentrate on that when what your mind really wants to do is pay attention to danger. Okay? It's very hard to do both at the same time. Be easily startled by unexpected noises. Yes, the stereotypical kind of backfiring car. That's true. But as someone brought up yesterday, it's also someone suddenly coming into the room. It's also a phone ringing behind you. It's also somebody coughing when you didn't know someone was there. At work, we have a veteran with PTSD. He's not someone you want to enter his office without knocking lightly. So if I come in and I say, hey, I've got a question for you, like that, he will jump. And it will take him probably half an hour to come down from that. So the flip side of that is also being, or the part of that is also being really irritable a lot. Because if this is how you're feeling, constantly alert, jittery, stressed, not being able to concentrate, not sleeping, you are going to be irritable. It's not uncommon to talk to a veteran with PTSD who averages 3 to 4 hours a night of sleep. Now think about it. If you got out of the military in 2003, and your average sleep has been 3 to 4 hours a night since that time, how has that affected your concentration, your ability to learn, your ability to make good judgments? It also incidentally affects your body's perception of pain. Chronic pain is much higher in folks who aren't sleeping. And then, of course, the chicken and the egg, then because you're in pain, you're not sleeping, and so on and so forth. So just sleep in and of itself causes a huge and deleterious effect in folks with PTSD. We could fix one part of PTSD. That's the first part I would fix. Who gets PTSD? Well, one thing that we know is that if you took 10 people into the same traumatic event, even if it was really traumatic, most of the folks would not actually walk away with PTSD. And let me just say, I want to differentiate. My mom is a therapist, and we argue about this all the time. One day she's going to be here, and she's actually going to argue with me. That's not to say that all 10 people aren't incredibly affected by what happens. That isn't to suggest that when you experience trauma, you don't have a really tremendous reaction to that. Everyone does. And if you don't, then we worry about you. What is true is that 8 out of 10 people, let's say, don't have PTSD. And I think what's happened is because PTSD has become so sort of popular in community speak, we relate it to having trauma and then feeling some kind of way about it. That's not PTSD. That's a perfectly natural response to trauma. It happens to not be PTSD. PTSD is a constellation of all these symptoms put together that are very intractable and difficult to deal with. So yes, anyone would have post-trauma reactions, but not necessarily this disorder. Okay? So who gets it? Well, if you've experienced trauma in your past, so those veterans that have had emotional traumas in their past, who have had childhood traumas, abuse, sexual assaults, neglect, all of those good things, are significantly more likely to have PTSD afterwards. If you've had family members with mental health problems, if you don't have a good social support system, and if you are female. Now, interestingly, the social support system, here's one that I want you to know a lot about. Why? Because having a social support system is also a buffer against increased levels of PTSD. So if somebody comes to your campus with some level of PTSD and you can provide them with a safe and comfortable social support system, you will be helping cure their PTSD. They'll experience significantly lower symptoms because they have that. And I think you'll hear from, maybe in those words, but you'll hear from our panelists later today that one in particular comes to mind that she was telling me that when she finally connected to her Veterans Resource Center and started going in there, it was like, and I would bet, I don't know if this veteran has PTSD, but if she did, I would bet that she would notice that she was sleeping a little bit better, that she was relating a little bit better and feeling a little bit safer, just because there was a group of folks that she felt comfortable with. So that's my plug for really building up community on your campuses, not just because it's a nice thing to do, but it creates a huge mental health positive buffer against trauma. What's difficult for a lot of veterans too is that sometimes the reason they went into the military was because they didn't have a positive social support network at home, right? And that includes family. And so when you come home, you're right back in that mess at the time that you need it the most. Very difficult. I imagine some of you are wondering, why is being female particularly connected with PTSD? Partly, I will tell you that I don't know. We know that rates for women are about double in the general population for PTSD. We're not really sure why. One theory is that women are much more likely to experience certain kinds of trauma, and that's why PTSD levels are high, and I think that that's true. And I really, again, I don't have a lot of evidence to back this up, but the theory that I feel most comfortable with is that our brains are wired just a little bit differently, generally. And that for whatever reason, women's brains tend to respond to trauma more likely with PTSD than men's do. It has nothing to do with toughness. It has nothing to do with strength of character, strength of will. Our brains are just a little bit different in general. Yeah?
I'm just wondering if that holds true of holding all the other factors constant, women. In other words, have studies been done like that?
I wonder too. I don't know. I don't know. I would say that the others are more important than that. I would say that having experienced trauma in your past is probably the most accurate predictor. That and social support are going to be the most accurate predictors of PTSD. There's an expression, that which doesn't kill you makes you stronger. Well, in the case of the military, like if you think about basic training, you go into basic training, it's really tough. I don't think I could do it. It's really scary. I don't think I can. It's such a long run, and its pack is so heavy. Oh my God, I did it, right? And at the end, you have this experience of doing something really hard, and you have this kind of growth that occurs because you've done something very stressful and difficult. That's not trauma. That's stress. So when we get through stress, we actually do get stronger, oftentimes. When we get through trauma, we typically are not stronger, we are a little bit cracked, right? In the same way that if you broke your ankle in high school, you would probably, even if you fixed it, your ankle would always be vulnerable to some other kind of fall later in life. Very similar idea. PTSD affects the brain. Let's hope my PowerPoint works here for a second. Are we going until 10:15? Anyone? 10:15, right?
I'm fixed, so I'm not giving you time.
Okay.
So.
You have the camera, so you look like you knew the answer to that. Okay. Fight or flight. Another way of thinking about PTSD is to think of PTSD as a constant state of fight or flight, which is to say heart rate and blood pressure increase, pupils dilate, muscles tense up, digestion ceases or slows down, and trouble focusing on small tasks. So a good way of thinking about the trouble focusing on small tasks is you're walking down the street and a dog jumps out at you, right in your face. What will you remember about that street the next time you walk down that same road? You will remember exactly what the house that has the dog looks like. Okay? You will remember what the dog looks like, you'll remember what the gate looks like, and so on and so forth. Will you remember if the house across the street or down the street has purple flowers? Absolutely not. Because your brain knows that it doesn't care. Your brain knows that it is very good at prioritizing, that really what it cares about is where the dog is. And so oftentimes schoolwork becomes the purple flowers down the street. That if your mind is constantly in fight or flight mode, trying to remember little details like, what am I supposed to get for, what groceries am I supposed to buy, or when was my homework, or what time is my test, all those kind of things kind of fall to the wayside because your brain is triaging on much more threat-related, danger-related things. Not that you're deliberately doing that, but that's just where your brain is focusing. And so one way to think about that is PTSD as an impaired fight or flight response. So if we go back millions of years, and I feel in the Bay Area I'm allowed to talk about evolution. I did that once in Indianapolis at a conference and was told not to. You're walking down the path a million years ago, and a lion comes out. Okay? I guess my sound isn't working. That's all right. You're walking down the path, and a lion comes out. Well, you have two responses. One response, it worked a little bit. One response is to run. Another response, to fight. Okay? Those are kind of your two responses. Oh, another third one is to freeze. Now, in the case of our military veterans who've had tremendous levels of training, are they more likely to flight or fight? Fight. Yeah. Okay? More likely to fight. You've had a lot of training, you've had a lot of experience. You're also part of a subset of people who volunteered to serve in the military. So right from the get-go, that was something that you might have been more comfortable doing, using aggression to solve problems. Yeah, more likely to fight. The problem with PTSD is that we have a fight or flight response even when the stressor is not actually dangerous. Okay, and so the experience of PTSD is having the same response to the kitten as to the saber-toothed tiger lion creature. Okay? Common fight or flight triggers include someone standing too close to you, strangers, feeling cornered, trapped, or stuck. Let me talk about somebody standing close to you. Okay, when I say that, I think what you think probably is like a close talker. Hi, how are you? Okay, that makes all of us uncomfortable. But for someone with PTSD, I may not have made you uncomfortable, but Someone with PTSD, someone standing too close to you is, I'm standing in the grocery line at Safeway, and this woman reached around me to grab the People magazine. And I wanted to punch her. And then I wanted to get out of there. Okay, that is the experience of PTSD. That's standing too close. I'm waiting to get money out of the ATM, and somebody is standing close to me. Why are they standing so close to me? What do they want? What are they going to do? And so on and so forth. Your mind starts to go. The person at the supermarket, I've talked to a number of veterans that have had this, where after that experience, standing in line at the supermarket, where someone was just a little too close, and they were putting their, it was heavy, so they put their stuff on the conveyor belt thing. And why would they do that? And then they get really upset, and maybe they'll turn around and they'll say, why are you standing so close to me? But then they feel embarrassed because they've had a little bit of an outburst and the person is shocked. That experience can stay with you for an hour, 2 hours, or 3 days until you settle down from that. Now, from our perspective, if you don't have PTSD, we haven't been in those situations, in combat situations, being in a supermarket and having someone pull a magazine around you, you don't even notice it. Right, and if you did notice it, would be, what's on? What did Lindsay Lohan do? Right, you're sort of paying attention to that. You're not really thinking of it as a threat, but the mind of PTSD experiences that as a threat. Feeling out of control or overwhelmed, reminders or association, and there can be many. A lack of order and chaos. So, where is that a problem? Did somebody say my office? Yeah. Where else can that be a problem? At school, class, especially classes where it's not really tightly run. Another place where it tends to be a big problem, and I'm certainly guilty of this, is when you come home from serving overseas and you remember, oh yeah, we have little children, and little children are, at least mine, seemed predestined to be chaos machines, right? It's actually their job to create chaos. And so for a veteran with PTSD, that's very, very stressful. Why? Because what they like is they want to come home, and when they open the door, everything should be in its place. And if something isn't in its place, if something is moved, if something isn't where it's supposed to be, then I'm starting to feel a little bit anxious. Why is it not in its place? Who moved it? If it's not there, what else isn't in its place? Okay, there's a lot of experience. It's very important to have order. Unfortunately, the rest of your family may not function that way. So if you return from war with PTSD, you would not want to come to my house. It would be really triggering. But that creates a lot of conflict within relationships. It's very hard for someone else to relate to that. Being surprised or startled, as we talked about. Some common triggers on campus. Parking lot. Parking lot is a huge trigger. You're trapped. You're surrounded by bad drivers. You can't find a spot. There are all sorts of stimuli to pay attention to, particularly if you're coming from an experience in wartime where vehicles exploded. You might try really hard to know all of the vehicles in the parking lot so that you can recognize what looks familiar to you and what doesn't look familiar to you. That could be impossible if it's a really big parking lot. You may want to park in the same place every time to create some predictability. That can be impossible if you're running late or someone parks in your spot, and so on and so forth. Parking lot. So just getting to school and dealing with the parking lot, often a trigger. Noises and distractions. You're sitting in class, and someone is running outside the class. I hear this a lot. Someone's running somewhere. That's what we hear, those of us without PTSD. Someone who's returned from the war hears this. And what many veterans will say is, when I hear a noise outside the classroom, I think something is happening, and I have to go out and investigate what it is, and I can't come back to class, and I can't pay attention until I've confirmed what that was. Especially if somebody was running, or especially if somebody was yelling. The experience is, I got to get up, and I got to go, and I got to figure this out. And if I don't get up, like if I'm in the middle of a test or in the middle of doing something where I can't get up, I will not be able to concentrate or feel comfortable until I'm actually out of this classroom and can see what that was. And why I'm pointing this out to you is because, again, if you don't have that experience, all you will hear is somebody talking or running outside of the class, and you may not even notice it. And you may not give it a second thought. To the degree that if I said, hey, remember when someone was running outside 10 minutes ago? You might say, no, I don't remember, because your mind didn't think it was important. But for our veterans, that can be a very important thing and very distracting. Time tests. Time tests can be very triggering for veterans with PTSD just because the pressure itself, the pressure to concentrate, if your mind is a mind that is struggling with concentration, the last thing that it needs is extra pressure. And so time tests often are the cause of failure, sort of academic failure for a lot of veterans with PTSD and traumatic brain injury, and why I encourage all the veterans that I talk to experience this kind of thing, go get an accommodation where you take the test without a time, or you take the test over a longer period of time, because many of the veterans will say, I know the material, I know it cold, I studied for 4 hours the night before, but as soon as we start, I can't pay attention. I hear everyone's pencil scratching. I'm looking at my watch, and then 20 minutes have passed, and I haven't done any part of the test yet. So as instructors, if you start to notice a huge difference between assignment quality and test quality, that's a good time to have a conversation. Yeah?
Can I just make a quick comment? I'm a
Yeah.
disability specialist.
Oh, good.
And one thing I do want to just warn instructors about is that your first response might be resistance when you offer going to disability resources and getting accommodation. And two, don't be discouraged by that. Just kind of keep pressing it. You might hear something like, well, but I don't want to take something from someone else, or I don't really need it, or I should get over this. There's a lot of things that are really common.
Yeah.
But I have found that if I really just talk it through logically with them, they go, oh, okay. And they come to a place of saying, yeah, you're right. That makes sense.
Yeah. Yeah, I agree. I agree with the resistance part, and I agree that persistence in the face of resistance sometimes gets you somewhere. Yeah, absolutely. Class assignments, we discussed some of them yesterday, but here's two that you may not have thought about. One is a dream journal, for example, or any kind of class assignment that asks for self-reflection. Particularly a dream journal could be really traumatic for people who are having very traumatic dreams. So what I have done in the past when I was teaching and I assigned a dream journal to people is I've always given them an alternative version. You can also write the dreams of some friends, or I would have an article about different dreams that they should read. Sometimes I would make up dreams and write them and ask them to kind of analyze them. And again, this is not just for veterans. There are lots of folks who've had trauma that are going to have really disturbing and problematic dreams. So self-reflection, self-reflective essays are often opportunities for triggers. Not to say not to do it, but usually if I'm going to do that, I would recommend offering some kind of alternative that doesn't force someone who may not be ready to be self-reflective or to share to do that. Another example of a class assignment would be any kind of public speaking or speech. That if you are experiencing a lot of fight or flight symptoms, being up again in front of a group of people you don't know and trust, right? We may not think of the word trust, but a veteran with PTSD will think of the word trust. If you're up in front of a group of folks that you don't know and trust, that can be absolutely incredibly uncomfortable to the point of not really being able to do it. And you're going to see some veterans drop out at that point. Or drink beforehand. That's another popular one. So again, if you notice that there's a lot of stress involved in that, and getting up and speaking is not actually critical to the veteran learning or to the student learning what you need them to learn. If it's a speech class, they might be out of luck. But if it's not, then maybe giving a public presentation is not necessarily a requirement, or may not have to be. Something to think about. It's not just about fear of public speaking, which lots of us have. It's also all this other stuff that comes with PTSD.
I have a question.
Yeah.
On the reflective writing,
Yeah.
I've had numerous veterans write about their experiences.
Yeah.
And they do get into some graphic type of information,
Yeah.
details, and what they've experienced, which are,
Sure.
And I have had faculty members calling me saying that they're in fear of their life and they're in fear that they're gonna come back and bring a gun and all these things. And we followed through with our mental health counseling and whatever and gone through guidelines, but what would be an appropriate response when you're responding to faculty members or people on a campus as to, I mean, because my response is pretty out there and blatant of, you have nothing to be fearful of, I mean, you know, and I go through that with them, but I'm thinking, is there something else that we can relate it to? Is there something preventive or anything like that?
Well, what I said yesterday in the talk, for those of you who heard it, is if you're going to ask for it, be prepared to get it. So if you're one thing I would tell instructors in general is if you're encouraging or allowing our veterans to write about their wartime experiences, be prepared for what you get, and what you get is not going to be PG rated, because war isn't PG rated. And it may include talking about violence, talking about the desire for violence, talking about some suicidal thoughts, wishing I was not here, that kind of things. And that's really common. It's pretty much impossible to go to war and have the kinds of experience that some of our veterans have and not have your mind on those things. War is a violent enterprise, right? And so I would say if you are an instructor that's interested in allowing your veterans to write about those things or wanting to encourage those who feel safe to do that, be prepared for that. In general, it's very hard for me to stand up here and say, oh, you should be worried or you shouldn't be worried about a particular thing. I would generally say that if a veteran is going to write about whatever it is, it's probably not because they're planning on it. That isn't to say that could never be the case, but typically not. I would handle it very, very sensitively, because the absolute last thing that you want to do, and I said this yesterday too, is ask a veteran to write or talk about the war and have the result be a conversation with campus security. And what you should know is that when you go to war and you have PTSD, and even when you don't, remember, what is it that we're training our combat troops to do? We talk about defending the country. But what we're really training them to do is to kill. And in the war in Iraq in particular, during certain periods, and in Afghanistan, they did a lot of it. They just did a lot of it. And so if we're asking them to talk about that, that's what we're asking them to talk about, and we should be prepared to hear about that. I'm not, another perfectly legitimate thing to say is, this isn't the place for that. You should do that with a counselor. You should do that in some other place. You could ask them not to do it, but if you're going to open the door, don't slam it shut when you don't like the results. And I get that for folks who haven't read those kinds of things and really talk, it can be very jarring to suddenly hear someone very nakedly and openly talking about violence and very nakedly and openly talking about the desire for violence, but that's really normal, very normal. I know I didn't totally answer the question, but I can do a little bit. Are we out of time?
Yes.
Okay, so why don't we take a break and we'll come back with part 2.